purpose is to obtain an update on the work of the 12 autism task forces and also to hear of their preliminary recommendations around 4 focused areas: early identification and treatment, medical health insurance by private insurance plans, employment, and housing. Today, the task forces are represented by the statewide coordinating council of autism task forces that consists of task force chairs and co-chairs. And this is the astounding number to me. As a result of the work that began with the Blue Ribbon Commission, predated the Blue Ribbon Commission, but the Blue Ribbon Commission, now the Senate Select Committee, and the establishment of these task forces, there are 55 stakeholders and 600 people across the state who are actively participating in developing the recommendations of which you will begin to hear about today. There's 1 task force in Sacramento, 4 in the Bay Area, 2 in the Central Valley, 2 in Los Angeles, 1 in Orange County, 1 in the Inland Empire, and 1 in Greater San Diego area. We all know the statistics. We repeat it in most every hearing about the increased incidence of autism and autism spectrum disorder. And a lot of people say, well, geez, we've got a bad budget time. How can we be focused on trying to advance something when we're merely trying to hold on? We are going to be out of these bad times, and sooner than you think. And we better be poised to launch new and important initiatives to meet the needs of people, for children and families in California. And at or near the top of the list is being more aggressive, more effective in being able to treat autism and autism spectrum disorders, to be able to continue the groundbreaking research, and to be able to provide the supports that are necessary for people who aren't going to be children forever, they're going to be adults, to be able to transition to a productive and good life. So let's hear the progress. Let's hear a little bit about what's going on around the state, and let this be another step towards implementation and action. Senator Wolk, is there anything you want to say? Of course.
Just would like to welcome you all, especially folks from the North Bay, of course. They've been working very hard, and I want to thank you, Darrell, for your leadership, and Lou, of course. And looking forward, we're going to be meeting once again in May to pull together our recommendations. So thank you for your leadership, and thank you all for your participation.
So let us begin with an overview of the task forces, and we're joined by 2 people again who don't really need introductions because they are so active in so many ways. Barbara Firestone, of course, who's the statewide chair, who's also the co-chair of the Blue Ribbon Task Force, and John Mathias, the statewide vice chair. Welcome to both of you. What's going on out there?
You on all of the work that's being done by these incredible task forces with so much representation here today. But I would be remiss if I did not begin by thanking you on behalf of the state, Darrell, for your extraordinary leadership on these issues. Don't do this. Okay. I mean, you stepped out more than 5 years ago. You have such a history of supporting issues that relate to children with special needs. And when you took that step, that bold step 5 years ago and chaired the Blue Ribbon Commission on Autism, you really made a tremendous statement that autism was going to be a priority in this state, and it has remained that priority even in the most challenging times. So part of what I wanted to say today on behalf of our group is to thank you, and to thank this extraordinary group of 14 senators, this bipartisan group of senators who share this passion and commitment and enthusiasm for creating change and quality and improved quality, promoting quality of life for individuals with autism.
I should just say, if I might, among the 14 senators, could you see that there's only two of us here. The reason is easy to explain. There are multiple committees going on. We're right in the heart of bill time, as we call it, and the committees have very long bill agendas, but I'm sure people will be, coming in and out as the afternoon proceeds. So let's get to it.
Well, precisely. You're in the heart of bill time, but you're both here. So thank you. Thank you very much. And we also would like to thank the state and you, Darrell, for introducing that resolution for making this Autism Awareness Month in California. And I'd like to turn to John to tell you a little bit about the work of our task forces before we turn it over.
Let's get right to the heart of it.
Okay.
What's happening?
We were going to tell you about all the 600 people, but you already know all about that. You just explained it to us.
Sorry, I didn't mean to steal your thunder.
But I do want to say one thing. My son turns 10 on Saturday, and he has no idea there's 600 people working so hard for him. He has no idea there's 14 senators working on his behalf, and he has no idea that Dr. Vismara has been doing so much to help this committee move on. We're very excited to share with you some of our very preliminary recommendations, and we have another 5 months or so to keep on working. But thank you so much for your leadership, and let's get to it.
And so now we are getting to it. We are going to be hearing a presentation from our first work group, Early Identification and Treatment. I would like to introduce Patrick Mayer, the panel chair. From NBART, Robert Riddick, Jan Blatcher, Ramona Puget, and Mary Mulway. Will you all please join us?
Why don't we come on up? We're going to need to make some room for people. Since this is not a bill hearing, if there's not enough room at the table, I don't mind panel members sort of sitting around the bend here too. Barbara, feel free to take a seat. Yeah, feel free to take a seat. Sure.
Your panel, the whole panel seat, you want to go down here. Speaking right to you.
Yeah. You might want to ask your task force members who are in the audience to stand up so we can thank them as well. And let me just say again, preliminarily, given that we are a legislature, we're very interested in everything, but most interested in how your recommendations can translate into specific public policy, because that's what we do, whether it's funding, which we know is a challenge at this point in time, or whether it is statutory changes that compel action either by the public sector or the private sector. That's what we're really listening for.
Darrell, if you would grant us the time, I would like to ask the chairs and co-chairs to introduce themselves, because they have provided really terrific leadership.
Please.
Please do so. Come on, guys.
Who are the...
Ramona Puget with the Current Autism Regional Task Force.
Very good.
Dr. Patrick Marr with North Bay.
Jan Blatcher, University of California, Riverside, and co-chair of the Inland Empire Autism Regional Task Force.
Robert Riddick, Central Valley.
Jose Fuentes, I'm in place of Rebecca Silva, Inland Empire as well.
Go ahead.
Chantal Cecile Cura, I'm from San Diego, Imperial and Inland Mountains.
Janice White, Orange County. Kristen Jacobson, Bay Area. Been on the way to the area.
Jim Burton, East Bay.
Rocio Smith, Bay.
Mary Molly, I'm from South County's Division Autism Center.
Very good. Thank you all for your... One more, I'm sorry.
Chuck Ansel, I'm from the Central Valley Autism Regional Task Force.
Welcome to all of you, and thank you. So let's hear about early identification and treatment, and what ground should we forge here in the legislature?
Okay. So anyway,
Introduce
once again,
yourself
these are...
again, if you would. Introduce yourself.
Oh, I'm sorry.
Yeah.
Dr. Patrick Marr, and I'm from North Bay Autism Regional Task Force, co-chairman. So the early identification and treatment, we really recognize there's three areas that we want to work on the recommendations. The first one is centered on the difficulties in assessing and navigating complex systems of care. We feel that this is especially true for certain ethnic groups, and so that there's really a need for culturally sensitive identification, because it's recognized that certain ethnic groups are recognized and diagnosed with autism at a later date than others. And so there's that disparity. And so we've come up with, on the sheet here, there's a number of ways that we've kind of to work on that, and that would be to to be in the community with cultural groups, faith-based organizations, nonprofit organizations, et cetera, to sort of be able to recognize that group. There's also recognize that there's certain problems once the person's identified, that at some regional centers there's a difficulties around with this, like a gatekeeper, that if they have a diagnosis such as PDNOS or Asperger's, that they are sort of not let in to go through the eligibility process. And so that's another issue that we would want to develop some sort of...
Explain that again, please. Who's gatekeeping who and what criteria?
The way the regional centers do that, there's what's known as intake workers or assessment counselors, and the initial interface with the regional center with the families is with those persons, and not with the clinical teams. And so that there are times, or certain regional centers that people have talked about at our meetings where they basically say that PDNOS and Asperger's is not an eligible condition, and therefore the persons, when they call in and they have that diagnosis, then they're told that no reason to really apply, and so they're never the whole process of, and people recognize that often persons that have a diagnosis of PDNOS or Asperger's by one clinician may receive the diagnosis of autistic disorder amongst another clinician. So it's...
And different regional centers have different criteria, and some will let in children who are self-described as Asperger's,
right.
Some will not.
They're not consistent.
It's not consistent.
And is it a poorly written state law that provides the ambiguity, or is it something else?
Huh? Well, the Letterman X says autism, and that is certain regional centers say that means autistic disorder, and does not include PDD-NOS or Asperger. So that's where it comes from.
PDNOS, just for the thousands watching at home.
Pervasive developmental.
Oh, I'm sorry.
In the mic.
Pervasive developmental disorder, not otherwise specified.
Okay.
Have the developmental centers then have the discretion.
Yeah, the regional
whether or
centers.
not the regional centers.
Each of the 21 regional centers
Yeah,
are independent 501c3s, and there is quite a bit of variability.
Right.
Lou, or Senator, in times of when money flows freely, this would not be an issue. But now when things are tight, this gatekeeper function becomes very critical. And some people have raised the issue, getting back to your question about what can we do, about the same people monitoring who comes through the gate as they're the same ones who give out the resources. And, we can talk afterwards about an experiment we're doing at our university to try to mitigate that in the Inland Empire. But that's the issue. If they're holding a limited purse and they're controlling who gets it, that's where the bad feeling comes.
I'm not necessarily defending the policy, but just to be the devil's advocate for a minute. So what's wrong with what they're doing in the sense that the limited resources are limited resources? So you either serve more people but less effectively, or fewer people with more intensive services. So what am I missing here in terms of the fact that there's no money? Believe me,
but isn't the real issue? The real issue is that there ought to be a uniform determination, and then the resource issue comes secondary.
There's another issue.
We wish that there were more, but the determination ought to be on a uniform basis.
Fair enough.
And I don't know. So my question would be, just following up on that, would be, is that best accomplished through regulation, or through legislation, or what would the mechanism to create that equality in assessment?
Well, I think that, once again, I think sometimes science may be ahead of legislation. But one of the things is that the new DSM-5 criteria is going, I mean, the DSM-5, which is coming up in a few years, is there's not going to be no longer any PD, NOS, and Asperger's. It's going to be all autistic spectrum disorder. It's not, it won't, it's 2013.
In the meantime, in order to eliminate this discrepancy, what would you recommend?
Well, I mean, my personal opinion is that we should be looking at autistic spectrum disorder and not looking at which specific diagnosis, and look at are they significantly handicapped, because there's the variability.
Okay, so if we adopted your approach, how best to have that be uniformly adopted across these regional centers?
A bill, a regulation?
Exactly. The mechanism to do that.
Right.
How is that best accomplished?
A uniform interpretation of the Lanterman Act. And I also want to make the statement that I believe that these discrepancies existed before budgetary restrictions. Historically, this has been the case that different regional centers have interpreted these regulations differently.
Across all disabilities, not just autism. But
who originates the regulation under which the 21...
The state of California.
Through which department?
Department of Developmental Services.
So the Department of Developmental Services, if we want to achieve uniformity, ought to either reissue what they already have adopted or adopt something different and then insist on its uniform application.
Exactly.
Okay. And is that a recommendation?
Yes.
Okay.
You know, another issue that was identified along with what Senator Ashburn just said is the efficient use of existing resources. For example, we heard testimony today that in some regional centers, experts have referred individuals from Stanford, the Mind Institute, and highly credible institutions with a diagnosis, and that diagnosis in some cases by certain regional centers has either been ignored or has been children have undergone extensive re-evaluation when such probably is not necessary.
So with what we just discussed in terms of mechanism, we could help to achieve that.
Absolutely.
Okay. One issue is the age that exists in the Lanterman Act, 3 years of age. In the regional center must make a determination of eligibility at 3 years versus, which is one of the recommendations, a longer period to determine the nature of the disability to perhaps age 5.
Yeah, maybe we can move on because that's one of the central parts of the second area, which is the difficulties in coordination of services and care between regional center and school district for children 0 to 5 years of age. And I think as just stated there was that most people recognize that often it's very difficult at the age of 3 or under to really say for sure that the person did his correct diagnosis because of the young age, and often there will be developmental delays in some of these children. So one of the recommendations is that there be continuing eligibility up through 5 years of age at the regional centers. And in addition, this collaboration between regional center and school districts, I think, is really paramount. Because for one thing, it's cost saving because you're not duplicating services. In addition, it's much easier for the family. So that I just want to go through one in our district, in our area. We do have a collaborative program, and one of the ideas I think was for recommendations would be around looking at these models that are throughout the state, because there's a number of them throughout the state that where there is this collaboration going on. In ours, we have a collaborative diagnostic clinic that is jointly done by regional center and the school districts. And the county office of educations are vendorized by regional center, so they send three clinicians, and then there's clinicians for regional center. We make the diagnosis, and they get both a medical diagnosis as well as the education criteria, whether they meet the education criteria. So the family doesn't have to go to two places, and they and then also the next steps of what each is going to do, regional center and schools.
Dr. Marr, if I could interrupt you, one of the things as I look at the draft of this particular recommendation, it would be helpful to have as part of the overall recommendation the models that you're suggesting, as best practices or whatever we wish to call them. If there are things work, this is a real opportunity statewide to figure out what does work, and we don't always do that, but we have an opportunity to do that. Find out what works, make that recommendation, and then others can benefit from that as well. You don't need our help for that, truly.
And then the other part of our thing is that we do have certain of the county office of education also are vendorized to provide the intervention service for kids under 3 and over 3, so that when they turn 3, they don't have to switch, which is very difficult on families and the children. And then the other thing we've been trying to work is an MOU where there would be a sharing of resources with Regional Center and the schools up to kindergarten. And part of that is that we're looking at is having a common professional qualifications so that the behavioralists, for example, at the Regional Center is required to have a BS, and schools required to have a high school degree. So we're working out so that they will have a common qualification so that there won't be any problem there. We also have an IEP, IPP done jointly. Also have outcome measures to make sure that the services provided are effective. And finally, there will be parent education about the intervention services and that. So that's kind of, but we've also, it's been very difficult, and because there are a number, I don't want to go into detail, but there are certain snags that because of regulations between, education regulations and the regional centers, certain things, the regulations, to try to work those together. So that's something that we could look at. Once again, if we had these models shown, people could say, oh, well, we did it this way. That's how we got around that type of thing. So, and then finally,
anything that we can assist in terms of removing barriers to those kinds of models or cooperation or programs.
Okay, great. Thank you.
Really a good thing to do.
Yeah. Yeah. And then finally, the third area is around the difficulty in obtaining appropriate evaluations and referrals for ASD from primary health care providers. And because the goal here would be to have universal screening where at certain ages, the same way that they get their immunizations, or that there would be these screenings done universally throughout the state. And we've thought of ways to try to do that. One would be to develop financial and educational incentives for physicians to do the screening and the evaluations through appropriate reimbursement, so they often don't get reimbursed for doing a screening or certain things by the health plans, as well as CMEs, because physicians are to improve in that area. So anyway, I didn't go into detail because we're supposed to be limited time here. But is there any questions from the panel about
I would
these
like to ask you, Mr. Chair, I would like to ask you about the physicians in terms of early identification and treatment. Do you see a need for further training, better training of physicians to recognize what is, after all, an evolving science?
Right. Yeah.
And where would that be? Where would the appropriate locus?
Maybe possibly making that a part of their licensee renewal.
Continuing education.
So that they are able to complete hours of training and a consistent diagnostic screening that's related to mental health. So not just, autism, but they're looking at that as, it could be a comorbid condition as well. They may notice there's bipolar symptoms there as well, so that they kind of have that flexibility. But giving them, licensing renewals is making part of that, of their.
Also, I think there should be in the trainings of physicians in medical schools that there should be sort of a uniform, that there are certain criteria that they receive certain education in the developmental areas, especially in pediatrics and family practice programs.
Senator Pavley?
I know the importance of early identification for intervention in that 0 to 5 age group, so that they're off to best start as possible when they reach kindergarten or whatever school they're going to. what kind of outreach is available? You sort of mentioned it indirectly to underserved communities who either one may not have the access to health care or have the information for parents to be, for lack of a better word, assertive enough to make sure that their child who may suffer some developmental delays is really carefully reviewed by a physician for perhaps having autism.
Yeah,
It's a real concern to me because if you don't catch them till kindergarten or first grade, you've really missed a window of opportunity that you can never reverse.
I mean, I think now there is no real standard, that's across the board. I think it's individualized depending on whichever the community that you're in.
Healthy Families Program, President Pro Tem Steinberg. Healthy Families Program, is there anything in that program that provides the education and identification skills when they visit these children, particularly in underserved communities and lower income communities? There is a great discrepancy. My district probably has a lot more children taking advantage of these services than other members' district. It came up in a discussion on the floor the other day for Autism Awareness Month, and that those discrepancies continue to this day. So I was wondering if Healthy Family Program has that education and ability to make that diagnosis.
Well, you were actually asking the question that I was going to get to as well, which is, as I look at the recommendations, I'm sorry I had to step out for a moment. You are talking about establishing a demonstration project at multiple sites to expand early identification programs and to develop a sort of standard or consistent surveillance and training protocol for early identification. And Senator Powley's question begs the one I was thinking of, is how do we pay for this again in these difficult times? And Healthy Families may be an angle, I don't know, but that leads me to, maybe you can answer, but that also leads me, I'll put this on the table as well, is Prop 10. The first 5 commissions throughout the counties. This seems right up the alley, and 0 to 5. And so what's happening in terms of the statewide first 5 commission, as well as the county first 5 commissions, in addition to Healthy Families?
I'd like to hear a lot more about that because there's money, and certainly a focus on that age, 0 to 5.
Yeah. I can speak a little bit to that. I'm at the University of California, Riverside, and we were one of the few UC campuses that had no autism center or nexus. And we now have in the Graduate School of Education SEARCH, which stands for Support, Education, Advocacy, Resources, Community, Hope. And while we're there to serve the educational needs of all families across the state, primarily identification and education, we are targeting low-income Spanish-speaking families. So everything we do is in Spanish and English. And First 5 of both Riverside and San Bernardino have recently funded efforts to train the staff, and the graduate students who are getting a PhD in research have an outreach commitment in autism as part of being a SEARCH fellow. And First 5 has funded them to receive the gold standard assessment training in autism. And recently, literally just beginning this month, is a new emergency effort to seek out low-incidence populations, primarily Spanish-speaking, and get them into the Autism Identification and Referral Network. Now, so that speaks to your question about what's happening with Prop 10 funds, but they're limited, and they have a beginning and they have an end. And so I think what would be nice would be to get some longevity and self-sustaining sorts of efforts to these experimental database programs. And everything we do will have an evidence base to share with you a year from now.
That's good. I'd like to hear perhaps from others throughout the state. I mean, it's such a wonderful opportunity with all of these groups that are meeting, whether you've had different experiences, positive, negative, with Prop 10 in this area, because it is one of the few areas that has any kind of funding for young children.
I can speak to the Central Valley and the 6 counties that are in our catchment area, and I think there's a renewed interest in Prop 5 of reaching out to the community that regional centers serve. So there are a number of very specific grants for local small communities and for the community at large. In Fresno County, for example, a common assessment center for all folks 0 to 5 where problems might be identified. So I see a whole range in First 5, at least in our area, really
What about healthy families? Is there any specific component of healthy families that addresses early identification? I mean, healthy families is
we keep expanding
health insurance. I guess it probably depends on the private plan that is being contracted. But does anybody know of any innovation when it comes to any of the healthy families providers around early identification? Nope. Okay, that's one we'll research and get back.
I can tell you that First 5, it was about 8 years ago, they gave the health group a very substantial grant to establish an innovative therapeutic preschool for children with autism. And currently funded, we're developing an autism toolkit, an early screening toolkit, to train staff members funded through First 5. And as you recall, Darrell, we had Senator Steinberg, several bills through the Blue Ribbon Commission that were passed by the legislature that didn't make it completely through, that had First 5 funding attached to it.
That's right.
We'll check into the healthy families. I suspect, though, that there's probably very limited reimbursement to the providers for doing the screening. There's an interesting model that I've recently encountered where one community actually brings volunteer physicians into underserved communities along with social workers, audiologists, et cetera, and they actually do a volunteer community-based screening, which I think is very innovative across developmental disabilities. In one 6-hour period, they screen 250 children for developmental disabilities.
That's really good.
There's good news and bad news with that. Of course, the good news is we would be identifying children early on with the potential of reversing some of the most non-reversible problems associated with autism in youth, before they're 5 years old or so. And the bad news is the cost of picking up the services. As we identify kids, they would become involved at the regional centers. And so it's, in the long run, obviously it's a cost savings and it's the right thing to do because the cost to our schools, from 5 to 18 or to 23 years old in many cases is intense. And so it makes so much sense to invest some of the early intervention strategies and make them available to children of all income groups.
And the regional centers, I think the beauty of this program is the regional centers are actually an integral part of the screening. So the idea is actually to make the screening of the regional centers more efficient and actually hopefully provide cost savings. But that's a very good thing.
We want to give another member of the audience who may want to say something. We probably want to go through the panels and then we'll invite people up to make a public comment, which would be fun. Just keep a little order. Okay. Thank you very much. Is there? So once again, I don't want to keep repeating myself, but I will. And that is, Dr. Firestone mentioned the fact that out of the Blue Ribbon Commission, we had specific pieces of legislation, some of which made it, some of which did not, some which were vetoed by the governor. The next chapter here, I would recommend to you, of your work here, is to look at those legislative efforts, some of the new approaches and ideas, and come forward to us as a select committee with specific legislative approaches, even if it's not this year, in preparation for the new session, the 2011-12 session, so that we can get a running start. Because this is great, but generic recommendations about increasing early identification are not, and that's not what you have here, I'm not saying, but need to be translated into, okay, how do we use the levers and the mechanisms that we have here to actually try to make that happen?
Well, we are committed to presenting very discrete recommendations.
Good, good. Thank you very much. Thank you.
One thing that came up with Senator Ashburn's line of questioning, I think it might have been when you were out of room, is a need for a uniform interpretation of the Lanterman Act. Between now and 2013, it's all over the place, and it's inconsistent with the regional centers. So I don't know if it needs a legislation as much as getting DDS to come up with a uniform interpretation.
Well, I think that definitely needs to be on the list here because it's that's a huge issue, and there may be parallel or alternative pathways to try to create that uniformity. But remember, you can create uniformity down, or you can create uniformity up.
Oh yeah.
And sometimes you want to be careful what we're asking for here in terms of the objective that we're trying to seek, which is expanded and increased services for children and families. All right, we have our next task force here, which is the medical insurance coverage by private health plans. Not an issue that's been in the news nationally at all, so it's good to bring it to our attention. Yes, and we're very pleased to be joined by Ariva Martin, who is not only a distinguished advocate, but an author as well. And Kristen Jacobson, who's been a dynamic advocate as well. And Chuck Genseel from CART, Jim Burton, and Kristen Byrne. Is Kristen... Kristen's with us, okay.
Chuck, you are part of this panel.
It's making its way up. Good afternoon, Senator Steinberg. Good afternoon, Senator Pavley. We are very honored to have an opportunity to present to this esteemed panel. I had the pleasure and honor of serving with Senator Steinberg on the California Blue Ribbon Commission on Autism and working on some of these issues that are so important to children. I am the chair of the South Los Angeles Regional Task Force for the Senate Select Committee, and I work closely with Senator Curran Price. And the issues that we heard about in early identification, issues of cultural bias, are issues that our task force have been working very diligently on, how to close that gap in diagnosis and intervention services for children who live in poor communities, children who are African American, children who are Latinos. And the issue of health insurance, by all means, impacts not just families who are affluent and families who have private health insurance, but also an issue of grave concerns to those families and constituents that I represent in South Los Angeles. And you've been introduced to the rest of the panelists, and we've had a very spirited discussion this morning about health insurance. We see an opportunity, a real opportunity for the state to receive some assistance with the tremendous cost of caring for children with autism. We know with the recent budget cuts that it's very difficult for families to receive often the services they desire and that they are medically necessary from regional centers and school districts. And health insurance is definitely one way that families can get the additional help that's needed. We are fortunate in the state to have the mental health parity bill, which does provide for some services for children with autism. But unfortunately, we as a group, we as leaders on this task force, we as families, and myself being a parent of a child with autism, have experienced a great deal of difficulty in accessing services through our private health insurances. Oftentimes, families are told that medically necessary services that have been recommended by their medical doctors, are not covered. Oftentimes, they're told that these services are educational instead of medical. Often, if services are provided, they're provided in a very limited fashion. For example, speech therapy, which most children with autism, particularly those that have moderate to severe autism, will require a great deal of. My own son didn't speak until he was 4 years old and received an extensive number of speech therapy services and continues today at 11 years old to require speech therapy in order for him to communicate. And often insurance carriers provide very limited speech therapy, whereas children with autism require much more extensive services. So we're just excited about the opportunity to close what we know to be some of the loopholes that prevent families from accessing private health insurance services and coverage for the intervention services for autism. So the recommendations are outlined in the materials, and there are 2 pages. And in the interest of time, I'm just going to highlight some that the task force or the insurance group feel are really important. And again, they have to do with how do we make the Mental Health Parity Act responsive? How do we make it a mandate that really meets the needs of children with autism? One of the things that is not in the materials but that was discussed earlier this morning was really maybe bringing together the Department of Managed Health Care to a Senate oversight hearing and getting a better understanding about how the health parity bill is being implemented, particularly around the issue of autism, because we know, again, that there are lots of loopholes that prevent families from accessing coverage. One of the other recommendations is to eliminate the delay with respect to grievances. When families do have grievances with their insurance carrier around the coverage of services, there are long periods. We've heard reports this morning of up to 7 months that it takes to get grievances resolved. So one of the recommendations is mandating that all grievances are responded to and resolved in a 30-day time period, and looking at other procedural loopholes that make it very difficult to facilitate expeditious coverage from private health insurance. One of the other recommendations is establishing standards and a certification process for qualified professionals. Often families who need ABA therapy or other types of therapies have been denied coverage because there aren't clear guidelines about what types of professionals can provide the intervention services. Another recommendation is that DMHC and the Department of Insurance establish guidelines and monitoring process to ensure that private health plans have in-network individuals who are trained in autism. Often when families are directed to medical networks, the individuals in those networks don't have sufficient training in the type of speech therapy that a nonverbal autistic child may need, or a psychologist that has not been involved with the evaluation and treatment of a child with autism. So ensuring that these health plans have networks that really encompass the experts that are needed to provide care for children with autism. So we're really looking at closing some of the procedural gaps and really addressing the whole issue of medical necessity and ensuring that issues related to autism are not written off as being educational, but are determined to be medically necessary. And ultimately, constituents around the state would like to see an autism mandated health insurance act. We know it's not possible in this legislative term, but there are 18 states in the country that have autism mandates around private health insurance. And given the significant role that you have played, Senator Steinberg, on this issue, and we know your commitment and the commitment of the California legislature, we're hopeful. We're hopeful as a community, we're hopeful as parents that in California's future that we can see a bill specifically addressed to provide coverage for children with autism.
Ms. Martin, can you give the public a real-life example of the lapse or the denial of coverage for what, real terms?
Yeah, I'm going to let Kristen respond to that. She's been intimately involved with this.
So I can give you an example of one particular family who tried to appeal for ABA coverage. Last December of 2008, was theoretically given an authorization by their health insurer. But
for
then
what?
For ABA treatment. They submitted a bill. It was never paid. It was never paid. For the first 4 months, they just got no response, which is effectively a denial. They finally got to the Department of Managed Health Care, and it took the Department of Managed Health Care until July of 2009, back and forth. We'd like a letter from your doctor. Is it really medically necessary? What kind of provider? When you said licensed provider, did you mean PhD? Did you mean 4 letters back and forth to the doctor? Could you clarify that again? July of 2009, the Department of Managed Health Care determined that it was medically, it was a covered benefit and couldn't be excluded. So then the health plan came back and said, oh, okay, well now we're going to say that we're just going to ignore that and we're not going to comply with the health department. Now we're saying we're going to give you 1 hour a week of ABA. Well, we want 25 hours a week. So in October, 11 months after the initial request, it went to medical review. In October, the medical review found that 25 hours a week was medically necessary. Again, the health department issued that statement. The health plan refused to implement it, and in December, 14 months after that family had applied for ABA, the health plan started covering it. However, it is now March, and every time a bill is submitted, despite the fact that there is an agreement between the health plan and the provider, it's denied every time.
Oh my God.
And so, I mean, that is one family, and that family spent, an enormous amount of money fighting this, and it's been 18 months, and they're still not getting their claims denied or paid for, despite the fact that there have been multiple regulations. So the procedural gaps have to be closed in many fronts. DMHC and DOI have to take 30 days. The health plans then have to comply with the orders. Medical review orders there's an order or a statute that says 5 days to comply. If it's a grievance, it should be 5 days to comply. Health plans should be compelled to comply with whatever decisions that the health department issues.
But your example is egregious.
It's
it
common.
It doesn't sound like a time frame issue as much as they're never going to comply.
They're never going to comply. As soon as you come up with,
how do you enforce the compliance?
As soon as you come up with one excuse, you have to. But there's procedural things that could fix it. You could require that the health plans put forth all the denial reasons up front. That you can't first say it's experimental, and then when you lose that, then say it's not medically necessary, and when you lose that, then, there's procedural. Right, if you don't initiate a denial reason, everything has to go to medical review. Right now, the lawyers are actually keeping probably the vast majority of ABA claims to go to medical review. But if an ABA claim can get in front of the doctors, 100% of the time it's found in favor of the families. So the health plans are now changing the denial reason to keep it away from the doctors. So I think Lou was mentioning this morning there's maybe some federal law that says any denial for any reason should maybe go before a medical review commission, so that you can't manufacture some excuse around I'm going to call it something else even though that's what it is. An individual medical necessity claim is supposed to be about an individual characteristic. This child has plateaued. This child won't benefit. It's not supposed to be, it's not effective for autism. And that's, right now, the health insurance plans are using every excuse and are being allowed to use every excuse just to continue to deny it.
And I think at the heart of it, Senators, is a recognition that these services that children with autism have are medically necessary. Because if philosophically, if that's not accepted, then that's how we get into this procedural bureaucratic maze. So you're given one excuse, you're given another excuse, and they just continue and continue. I work with a family that had a child in UCLA's overnight program. They have like this extensive hospitalization program, and the insurance carrier covered it for a week, covered it for a short time period, then sent a denial letter. And the child was in this program for about 6 weeks, and back and forth, there was coverage, and then there was denial. There was coverage, and there was denial. And at the heart of it, again, there's not a recognition that these services are medical services versus this kind of nebulous educational context that they're often described as.
If 100% of medical reviews are finding a treatment medically necessary, at some point then it needs to be legislated that you can no longer claim that 100%. Who wins 100% of cases? 100% of ABA cases are found to be medically necessary. At some point, the legislature, somebody needs to step in and clarify that once you've had X number of wins, around experimental, around medically necessary, that those denials are no longer allowable, that it is been determined. The health department sent out to their own independent medical reviewers, Cheddar, the Center for Dispute Healthcare Resolution, and said, please research this condition and find out, what does the research say on ABA? Now we have the National Standards Project that's also done the same thing. They've all said this is medically necessary. At some point, we need to legislate that they have to actually follow these medical standards.
Go ahead, sir. Take the mic.
I would like to even give you a more current example. I have in my hand here a denial from my service or my health insurance carrier.
What's the name of the company?
It is Kaiser, and this is their prognosis. This is what they wrote in my medical review. This is for my granddaughter. It says, prognosis, due to the nature of her diagnosis, prognosis for any significant gains in coordination and functionality ability is poor. And their recommendation, the following line, states, quote, recommendations, it is recommended that Michelle continue to receive current occupational therapy services provided at an outside agency as well as support service in the educational home environment. They're recommending OT, but they're telling us we have to go to an outside agency to get it. That's, quote, their words. These are not made up by me, and we currently have an grievance.
And you're saying that the Department of Managed Health Care has opined in one or more cases that the therapy, it's described the name of the therapy again?
This particular therapy is occupational therapy.
ABA is applied behavior analysis, which is the behavioral therapy, but he's talking about occupational therapy.
My granddaughter has autism, and a specific type of autism is called Rett's. It's a particular debilitating type of autism.
But again, for the public and for myself and the other members, I want to understand ABA therapy is sort of state of the art, correct?
Yes, behavioral therapy, yes.
Okay, now my question is Department of Managed Health Care opined that ABA therapy is medically necessary for purposes of private health care coverage?
No. In most cases, the DMHC is opining that ABA therapy is not medically necessary, and often it's characterized as an educational service.
It's allowed to be excluded as a non-covered benefit, and right now the current reasoning is that it's not done by a licensed provider.
So, Ms. Jacobson, you said a moment ago the example you were citing was not an ABA example?
No, mine was an ABA example, but that family, DMHC has basically split a very fine line, and if you can get a clinician to write a letter, i.e. if you're rich enough to go out of network and pay for your own doctor to do an assessment and not access your health coverage, then you get your doctor to write that it needs to be done by a licensed clinician. In that case, they will then forward it to medical review and decide it's covered, even though there is no California requirement that it has to be done by a licensed clinician, and that's not the standard of care.
So they have opined.
They have opined.
Where there is a licensed clinician certifies that the particular form of therapy, state-of-the-art therapy, is medically necessary.
And is delivered by the licensed person. It cannot just be prescribed.
I understand that.
Sorry.
It's okay.
And the issue, just to clarify for the public, Senator Steinberg, is in most cases the ABA therapies that are provided to children are not usually provided by licensed professionals. They are professionals that have certification, they have training, but they're not licensed oftentimes by the state of California.
But the therapy itself is the same, whether it's provided by a medical clinician or a non-medical clinician.
Yes, the therapy often looks exactly the same.
And if you're, say, in Kaiser, it's because the health plan manages the clinicians. They will not permit their doctors to recommend ABA therapy. And so if you are within Kaiser, which is a very large percentage of the population of California, you cannot get that letter. So that's what I meant. You have to have enough money to be able to go pay privately to go to Stanford or somewhere else that could give you that recommendation, because Kaiser will not allow their clinicians to recommend it.
I understand. Sir?
I think, excuse me. Just to add, I think the situation has gotten much more difficult this year for our families because of the requirements in trailer bill language that families must apply for health insurance coverage in order to retain some of their regional center services. And so we send families into these fights, David and Goliath fights. Thankfully, like David, some of them win, a number of them win, but they really need more support, much more support in dealing with the health insurance. There needs to be much more clarity. They're put into hoop after hoop after hoop, brick wall after brick wall, and it isn't okay, particularly as you're trying to deal with your family situation and the many challenges there.
Well, certainly as a follow-up to this hearing, I would like to extend an invitation to the health insurance representatives, either collectively or individually, to come before the select committee and to engage in a discussion on this topic. I think it's very, very important that we hear their side and to explore, one, what the policy is, and two, whether it is being enforced or implemented consistently. So I want to make sure we have a subsequent hearing where we can engage publicly and directly, constructively, and try to seek some answers here. Because, the answer, it should be yes or no. It should be yes. But it's as bad as the lack of services is, it's also the torture that families themselves go through in trying to get help for their kids, and the ambiguity in the process and the lack of compliance where there's an order that has been made. It's very troubling. So that's reason enough to hold a second hearing and another hearing of the select committee, and I'd say sooner rather than later, and let's engage.
There are some health insurance companies that it would be worth including in that hearing who work for the self-funded companies, because there's a growing number of federally regulated companies where they're actually implementing and proactively putting in autism benefits, and that would be good to include.
Senator Patton.
Yes, one of the recommendations regarding a 30-day limit on resolving appeals and grievances. Is that something that requires legislation?
Say that again, please.
One of the recommendations on that they had offered, that's also part of their report, is that all grievances and appeals that are submitted appropriately to the Department of Manager Health Care must be resolved within 30 days.
I refer you to Senate Bill 1283.
Is it by Steinberg?
Authored by a guy named Steinberg.
Not Pavberg or Stein.
I can introduce you if you'd like.
Okay, so it's introduced.
Yes.
This year.
This year, scheduled for its first hearing in Health Committee sometime over the next couple of weeks.
I would be on the Health Committee. Okay.
Good. Thank you.
Well, we appreciate
1283.
I appreciate, Senator Steinberg, your request and recommendation that we do hold hearings with the Department of Managed Health Care and invite those health care providers. I think that's a great first step in terms of getting the issues vetted and having further discussion that can hopefully lead to the kind of clarification that families need in order to navigate the systems so that health care can be available. And it will help tremendously eliminate the burdens that families face in getting services from regional centers and their school districts.
And it will potentially save the state an enormous amount of money, because the regional centers are supposed to be the provider of last resort, and right now they're the provider of first resort.
Yep.
Let us move to thank you.
Thank you.
Very illuminating. Again, we're going to give members of the public the opportunity in any of these categories to come up and testify today if they desire. We've got two more. Training and employment. Chantal Cecilie Kira, the panel chair. Janice White from OCART. Angela Barker from SF Mart. Rebecca Silva from EART. and Michael Clark from CART. We've got to work on these acronyms, everybody. I'm telling you. Okay. Again, as you can tell, we're sort of conducting this a little informally and conversationally, so not necessarily like read a long statement. In fact, it'd be better if you just jumped in and engaged in the conversation here about training and employment. We know things like the Workforce Investment Act. We know that California gets hundreds of millions of dollars of federal workforce training dollars. We know that some schools have career tech ed programs, not nearly enough. So, again, what's the state of this situation, and what can we do to help?
So my name is Chantel Cecile Cura, and I'm the co-chair of the SCART, which, good thing there's an R in there, would be SCAT, which would be even worse. But training and employment, as we're looking at it, there's really two prongs to it, and one is obviously training of the person on the spectrum, but there's also the community awareness and training of the people that are supposedly there to help them in terms of getting employment. And so we looked at areas in which wouldn't cost the government a lot of money, but could move towards getting better awareness and training. So the first one about the stigma towards employees with developmental disabilities, or the lack of knowledge because of the unemployment rate is so high for people with disabilities, including those with autism. One of the things that we thought about is the way that there was a simple video that was made to help with the police training. And although we can't mandate that a video be given everywhere, starting with state agencies, state colleges, agencies, government offices, perhaps they could, in their training, also be required to have training on autism or related disorders, because when it comes to hiring, then they would have a better idea of people with autism. The other thing about how do we get jobs as we get older? It's because people know us. We network. Well, if kids are in the schools and they're never really associating with their peers and nobody has a really positive image about people on the spectrum, they're not going to get hired. So we have the Red Ribbon Week. Ever since the kids are in school, they're told don't drink, don't smoke. Well, how about a Blue Ribbon Week where we have ability awareness? So for a week every year in the schools, people get to know about people that are different than us, but that have abilities, strengths, and challenges. And it may sound silly, but this is how you get...
That does not sound
well,
silly.
It does in the sense of people think like, okay, how about telling someone in kindergarten, what's that going to do for someone with work? But that's where it starts, is in the community.
That is profound in its simplicity.
It is very simple.
And very important.
So that's one area that we would like to promote.
I'll just throw in, as a mother of an autistic kid, the bullying and the insensitivity, especially at the middle school level, is horrible.
Right, and in fact in here, and I have to say this personally, this implementing the Stop the R Word campaign that's in here, I like the philosophy behind it, but I wouldn't recommend saying something negative to bring about a positive, and I would prefer something more like an ability awareness week. In terms of the lack of incentives to hire individuals with developmental disabilities, again, we've started doing something that's simple, but again, it's to bring out the fact that there are employers who are actively hiring people with developmental disabilities, including autism, who've been successful, and we're highlighting that with an Excellence in Employment Award. And for example, in our area, and this is a perfect thing because there are a lot of people with Asperger's who have a lot of strengths but have a hard time managing the networking or making connections for jobs. There's someone in our area who knows this individual who's really into reviewing things, and he hooked him up with a magazine that creates SAT tests and all these other kinds of tests, and this person with Asperger's is really good at creating tests and creating review systems. So now this employer is in LA, this person's in San Diego, but they can do everything over the internet, and this young man is now earning a living. And it's these kind of things that we have to promote, and by giving attention to those kinds of things, we hope to help a little at the time. We also know that for a while there was a lot of self-employment or micro-enterprise kind of things that were tried around the state at different regional centers. I know in Los Angeles and San Diego specifically. And now some of that has been cut because of funding. But we were thinking perhaps of partnering with the local chambers of commerce. And also in California, you have SCORE, which is retired executives who are always looking to help people with autism, well, people trying to find work. So why not get them hooked up there? Inadequate coordination and integration of employment support services is a problem. Well, we thought, why not use the community colleges? Because they're a great resource in our communities for having a pilot program, maybe trying in one area to establish a one-stop information and resource center where people with autism or on the spectrum can actually get more training, but also get mentoring, because mentoring is a big thing for getting work for those who have developmental disabilities. Also, this is a good way to train job coaches, because the problem is a lot of the job coaches have no training when it comes to autism. And it's totally different from working with somebody with autism than with Down syndrome. Two other areas that are not mentioned in here but that we're working on is one big problem for those who have Asperger's who are in college is that when they're over 18, their parents are not allowed to go in and help them advocate for themselves and to ask for the accommodations they need. And so a lot of the students are failing in colleges because even though they may have wonderful disabled student services, they don't know what accommodations to ask for, or the accommodations that are there are not in line. So we have some people in our different task force that are coming together with some specific recommendations based on what's worked in certain disabled student services, who have a good ratio of working well with people who have Asperger's, and also with students who have Asperger's themselves. So that could be a way if we could somehow get better knowledge of those accommodations to community college disabled services. And the last one is a problem about information. There are resources out there, but what happens, and there's been research on this, in the transition from the adolescence into adulthood is one where totally falls apart. The research showing the depression in families, because they've had regional center helping them along, they've had the school district helping them along, and even though we have these individualized transition plans in school, where supposedly we're supposed to have Department of Rehab, Housing, and also SSI taking over and coming into the meetings and sort of getting connected with the parent and the person on the spectrum, it isn't happening, and there's a lack of information. And if there could be a website, maybe this could be something that the regional center must have that has the information so parents and also consumers, because we have to remember some of the consumers are not dependent on their parents, they have a hard time accessing the information. Even a regular individual who is really smart and gutsy tries to access SSI, tries to access Department of Rehab, they don't get what they need. So imagine people who have autism. It's really difficult. So if there was a website or a way for people to access information, and if there's a way of getting that without much funding by the community colleges are always looking, they have classes where they have students looking for projects to put together. This could be a school project for community college.
I want to make sure that we...
yes. So that's it. I'm done.
I'm going to have to leave in about 20 minutes. So I want to make sure that we cover as much as we can. Go ahead. Yeah.
I just have two quick cost-effective measures. You had talked about models and best practices. One is, as you look at bullying, there's the positive behavior intervention supports that has come out of the state of Washington. It's a school-wide training to help everyone, from the custodian, the secretary, all the students, have respect for one another. In Orange County, that is also funded by our Mental Health Services Act. And
hey, tell me more.
And it's working.
Love that act.
Yes. So if that's duplicated in other areas, teaching people how to get along, it addresses the bullying issues that you had brought up too.
It's better than the R word.
It's better than the R word, yeah. Also, another model that we're using in Orange County, and we've also shared with Whittier and Vallejo School District, is looking at blended funding strategies and getting actually grants. It's writing grants that are out there, federal grants, having a technical assistance network. We have one of our school districts, I shared with Chantel, Irvine. This lady is able to get multi-million-dollar grants to Orange County, and she said she'd be glad to share this with the whole state. And she has, on occasion, a list of potential funding sources that are out there. How can we bring that money into the state of California?
We ought to meet with her.
Yeah.
Yeah, put her on the budget committee. I mean,
she'll pay for lunch.
Yeah. Thank you. Two good ideas. Next. Anything to add?
Oh, I just had one comment.
Your name, please?
Oh, I'm sorry, Angela Barker.
Hi.
Hi.
Yeah.
And our housing group, our employment group was wondering about the funds for Jobs Now and why in San Francisco we weren't able to access that money from the Federal Recovery Act for people. They had to be under the age of 18, which is typically not when people are working in our population. So just wanted to bring that.
Do you know the answer to that one, Dr. Wismar?
We're working with DSS. This is a funding program apparently where in order to qualify you have to have a child under the age of 18. Apparently the existing funds, and obviously many individuals with developmental disabilities are not parents. So we're pursuing whether a waiver could be obtained so those funds, if they're available, could also be used for individuals with developmental disabilities. And thank you for bringing that forward. This idea came out of San Francisco, yes.
It begs a larger question, too, about the federal ARA funds, of which we know there's a lot of discretion and a lot of different categories. There's job training, there's education, and whether or not the advocacy community here has sort of galvanized around a strategy, both the state level and the local level, to try to capture some of those resources for some of the issues that we're talking about here today. Even healthcare, in the healthcare arena, there's a lot of money that is potentially available. A lot of health information technology dollars. Is there an early assessment angle there with health information technology? It just seems to me that where there are new resources, that there ought to be sort of a larger organizational strategy to figure out how the community and the families that you are serving can gain some of them. Maybe it's already happening. I don't know.
A brief comment. I know you have to leave, Senator Pro Tem Steinberg, but a lot of good sort of creative, cost-effective ideas just brought out in this panel, and just wanted to really emphasize the need for those transition plans from school to adulthood. There isn't that information available. The schools don't have it regional. You have to be able to somehow find these resources and options that are available for work training or other kinds of programs, and somehow our K-12 school system doesn't have the idea unless someone at that school happened to take an interest in this area. So with the dramatic increase in the number of children that are diagnosed with somewhere on the autism spectrum list, this is going to be an increasingly important problem, and it's one of those issues parents are very concerned about as your child hits about 16 or 17 and you realize, oh my God, what do we do next?
I have another, Senator, do you have a comment? I know I've got one other suggestion I want to put forward to take back.
I like the grant money idea, whoever, Irvine.
Yeah.
Thank you, Senator Steinberg, and I apologize to everyone for having been close but not quite here during this hearing. I've been in the Judiciary Committee hearing where I've had to cast some votes this same hour, but I did want to get over here. I've got to go back in a few seconds to thank Senator Steinberg not only for convening this hearing but also for putting this regional task force plan into play. And I'm really indebted to Angela Barker and to others in the San Francisco and Marin area for helping organize and lead our regional task force, which has been meeting, and I think we're making great grounds. Just bringing attention to the issue and to recognizing that the numbers just keep growing exponentially, and how frightful it is that we don't yet have an understanding as what is responsible for this. Dr. Bismar is leading a great charge, and I know he's doing double time, making it all around the state to all of our different regional task forces. And I think our hope is that through this process, we'll really be able to be more sensitive to and more creative in accessing dollars that are available that could be directed in a way that's going to be beneficial, and just making sure that by putting all of our minds together, we can deal with all of the many issues on the agenda today, from insurance to employment and training, housing, and all that goes into. And then I suspect you've already made mention of the fact that I think I saw that one figure, 84% of Californians on the spectrum are under the age of 22.
Yes.
And as you've said, Senator Steinberg, that through early intervention and attention and service provision, we can not only make sure that a young life has every potential for fulfillment, but also save the state upwards of 2/3 of the medical costs that would be incurred if that early intervention is not engaged. So there is a lot that we can do that can change the course of this phenomenon.
That's also, if I may, part of the conversation to have with the insurance industry as well, about the cost to the companies and the policyholders of all the back-end kind of care when we're fighting about this potentially landmark therapy, when they're fighting about this potential landmark therapy, the ABA therapy, that could prevent those sorts of huge costs down the line. The other one, I just want to make sure I touch on one other thing, because I think it's part of it as well. Number one takeaway here, please, is let's come back here with a really well thought out ARA strategy, because just to make sure we're not missing anything in terms of the federal funds in all of these, in all the different areas. But the other one I wanted to mention is career technical education in high schools and community colleges. This is a larger issue than just autism spectrum disorder, but it is certainly relevant to those children and families, because you talk about, Senator Pavlik talks about, you know, geez, the parents say at age 16 and 17, you know, what are we going to do as the young adult ages out? Well, systemically, we should be answering that question, and the public schools should be part of that, not just in terms of what the transition is going to be, but what kind of education and training can we begin in the 9th, 10th, and 11th grades to begin pointing a child and a young adult towards a particular career pathway. And I don't know that this is being looked at. I know I have a bill right now, imperfect bill, but it's going to be a stalking horse to try to test this, to provide a tax credit to the business community for partnering with public educators to create career pathways. Certainly, and we're going to pay for it, by the way, by eliminating some tax credits that maybe aren't actually creating jobs. Just a novel concept. But I'd like you to look at career technical education in the high schools as a way to begin addressing this issue of employment and young adulthood. Yeah, and maybe era funding. Anybody else?
Just one last comment was that for people that are not regional center clients, then it's particularly difficult because they don't have the services in place to help with those transitions. And I'm sure some of you would have minded having Michael Burry, the Asperger guy that just returned over 400% betting against subprime mortgage business, handling your funds. There's a new book out by Michael Lewis, kind of him. So
put him on the budget committee.
That's my recommendation.
But again, it is true that a lot of the resources are out there, but it's getting the information out, and there's just we need to get information between all the agencies and the parents and the consumers.
Thank you all very, very much. Continued discussion. Last but not least, housing, appropriate and affordable housing. Rocio Smith, excuse me, the panel chair. Lisa Jackson, Robert Phillips, and Mark Jackson. I've got to step out for just a minute. I'll come right back. Senator Leno, would you mind? Thank you.
Ms. Smith, welcome.
Thank you, Senator Leno. And Senator Pavley. Because we do not have time, I'm just going to go really fast. You have the report. The report that you have is a work in progress, which is going to be amended again and again until we have gotten our hands around, our arms around this issue. But there are 4 issues that we want to address. Information and data. There is not enough information in the system to know what the problem is like for housing. We really do not know. We know that over 75% of adults, of clients of the regional center live with family, but we do not know what they need. We have guesstimates, we have ideas, but we do not know it.
I've seen a figure recently that 9% of adults on the spectrum are living independently. Is that do we have
are living independently?
Yeah, 9%.
9%. That is probably correct. I do not have it, but that sounds appropriate. It's not just that the system doesn't know, but the families do not have information. They do not have information about employment. They do not have information about housing choices. So those 2 things need to be addressed. There are not enough resources for affordable housing. We have some things in the report, but we would like to, I think what is most needed is to develop a permanent source of funding for affordable housing, which will include incentives for the inclusion of housing for people with developmental disabilities and on the autism spectrum. So there are some other ideas. This one is, I'm skimming because we have to go, and these are the real experts. Incentives for developers and builders, waivers, tax incentives, reduce red tape, flexibility, all of those things are needed to increase the housing stock that we will then be able to get for people with developmental disabilities. There is not sufficient stable housing for regional center consumers. And, that may be one of the reasons why so many of them live still with the family. But there are not enough resources out there. Utilizing some potential tools like legacy homes, which is when the family purchases the home or gives the home to the person with developmental disabilities, and it is put on with a non-profit housing corporation, which will, after the person passes on, that stock of housing will remain in the system. It's similar to the houses that were purchased under for the Agnews closure. Those houses will now be in perpetuity for the use of people with developmental disabilities with autism. And Senator Steinberg's bill, Senate Bill 1175, which does part of that, which is separate housing from services and develop housing that will stay in perpetuity, needs to be implemented statewide with strength. And what would you like to say?
Thank you, Ms. Smith. Ms. Jackson, welcome.
Thank you. I would say that we really need to look at housing from a number of perspectives, but the basic bottom line is to develop a range of housing options for people with autism, people with developmental disabilities that may choose to stay at home, for those that may choose to live in the community, and then also for those that need a more residential type setting. And there are some specific pieces of legislation that I think that this task group could put forward, one of which is to support SB 812, which I understand is over in the Assembly right now, which would require housing information to be included in the housing needs information of people with developmental disabilities to be included in housing elements at the local jurisdiction. And what we really need to do on that is to make sure that we as a system implement that. That is, we as a regional center system, I'm speaking from the regional center system because I'm associated with ARCA, but that information on a local level gets to the local jurisdictions, and that could be coordinated at the statewide level. Also, there's federal legislation that I think that the California legislature could support, which is H.R. 1205, which sets up a what's called ABLE accounts, which is a mechanism for parents to save pre-tax or tax shelter dollars, basically, for housing and employment and issues like that. And also, we can.
May I just? I'm sorry. May I just follow up on that question, because that's something I've been thinking about. Because one of the problems is to maintain your Medicare insurance, you can never have more than $2,000 in the bank. Someone who's developmentally disabled. So if the parents put aside, set up through this federal program, a tax shelter, that doesn't take into account or the Social Security limitations?
It does. It does. It's similar to like a 529 account that the parents can save for their child in a separate account, which would not affect would affect the child's benefits. And
then that can be put in a will for either another sibling or someone to administer. And
exactly, right. And that legislation has already been introduced, and only 13 representatives from California are co-sponsors. So we would like to see possibly a joint Senate resolution in support of that legislation to move that forward. And then we understand that the only way to create more affordable housing is to create funding streams, but obviously in this day and age we can't create new funding streams, so we need to work with what we have. And one idea that we have put forward is working with redevelopment agencies and looking at that. They have a requirement basically of 20% of their tax increment funding revenues go for developing affordable housing. But what if we said 5% or 2% or 10% would go to develop housing for people at extremely low income? So that is 30% of ELI. Or below. I think that would, the funding is already there, so that might be a mechanism. And
those funds are not always utilized.
Yeah, I know that.
So they go.
It's the 20% set aside for local governments on requirements on affordable housing, but it could be a permissive or up to 5% or whatever it could be used for developmentally disabled. Of the 20.
Extremely low income.
Not additional requirements.
20 of the 20?
No.
Up to 5% of
5 of the 20 are
something
2 of the
like
20.
that.
Right. Right. And we know right now would not be, obviously the best time, but times will change. Times are going to get better for redevelopment agencies. And then I think lastly,
go ahead. Sorry, there's little editorial comments here. Go ahead.
And the idea of supporting a statewide effort around creating a permanent source for affordable housing is...
we're working on it. I carried
know.
the bill, SB 500.
Yep.
We're trying to figure out the source that's
right.
saleable, if you will, in the political context. And it's hard to do set-asides during these difficult economic times, but we're going to revisit that issue next year.
And I think that this task force, and I certainly know I speak for all of the housing folks, would be wanting and willing to help you on that effort, and I know Housing California is working very hard on that.
Be a very important part of that constituency going forward, given your organization and you know, well-developed advocacy skills. Be very, very important. Okay. Anything else?
I'll give 2 seconds. I'm Mark Jackson with the San Francisco Marin Task Force. I think in addition to what Lisa and Rocio have said, that we need a general recognition that autism is a spectrum when it comes to housing, and that the needs that are currently being served by the developmental disabilities community are different for autism. There's a much greater concern, I think, among families and parents for safety, security. A lot of families are worried about isolation for their kids, getting moved into smaller group homes and the like. So there's a range that might be appropriate for some people. Larger settings might be appropriate for others. I think to simplify the housing model at some point, the current affordable housing model requires at least 6 levels of funding, from construction loans to tax credits to grants, donations. It's ultimately complicated, ultimately time-consuming, taking 5 to 6 years for a lot of projects. And we don't have that kind of time to address this need for our kids going forward. We'd like to, we've talked about having a housing summit at some point, and I think it's more essential than ever to organize that, to come up with more specific recommendations and best practices models for the Senate committee when we present our options, because there are some very, housing is a huge portion of our costs of living in California.
I don't know a way around, and boy, if we can come up with it, it'd be great, a way around the 6 layers that you just described a moment ago. Because we're doing it with the Mental Health Services Act, right. Prop 63. One of the great things that the Act is doing is that, early on we set aside $200 million for the capital side of supportive housing for the homeless, mentally ill. And what happens is MHSA now is one of the key layers in a number of projects. It's not 100% funding, but without it, there'd be a gap that would, and it provides specific housing, at least some of the units, for those living with mental illness.
Yeah, Senator Steinberg, this morning at the meeting, it was reported that in several communities, the MHSA funding is not available for people with autism and dual diagnosed with mental health. That some communities have said we will not fund that kind of project.
That seems odd to me.
I know.
Something that we ought to check into, especially the dual diagnosis piece of it.
They don't consider dual diagnosis. Once you have autism, it doesn't matter if you have other diagnoses. In some communities. I'm
going to ask our task force chairs and our executive director to report back on that, because that troubles me if that's the case.
If I could say, I think part of the issue that we might be seeing on that is the numbers of people with developmental disabilities that have an actual dual diagnosis are very low. And so across the board, we are going to see people that are in housing that was developed with MHSA money, a lot lower than we would see people in housing, for instance, with MHP money through HCD or other mechanisms. So that's my 2 cents.
Okay. Briefly, if you don't mind.
Yeah, very briefly, something mentioned before, the infamous sort of individual transition plans that occur as part of that IEP process. And the issue is how to get information to families and get information into the discussion in those ITPs. And so we need to look at various ways to do that. Certainly the regional center case managers being participants there and coming with information, because it's often an area that is overlooked.
One thing I would suggest is that you get to know the gentleman sitting 2 seats to my right, Senator Dutton, who is the incoming Republican leader, was also, I would say, the lead negotiator on the Republican side on the whole infrastructure package from 2006, including Proposition 1C, which was the housing measure, and a lot of expertise, and I suggest
if I could just
make
say
that
also,
link.
on Proposition 1C, as far as the housing goes, the funds that have been used through that to fund housing specifically for people with developmental disabilities that were included has been invaluable. And I'm sad to see it go away, and I think that's why I'm pushing so hard for a permanent source.
Right.
Hundreds of units were built with that money, so...
Very good. All right, thank you all, panel, very, very much. Are there members of the public that want to testify who were not part of the panel? Or if there is, I know if there are 3 or 4, I know I'm going to have to excuse myself, and Senator Dutton agreed to take the gavel here for the public testimony. I will get a report on your testimony. I just have to...
Senator Steinberg, before you
upstairs.
leave, however, we would like to thank you and the members of the Select Committee for this opportunity. And even though we are always a very energetic group, I think we're even more energized now with all of the proactive steps that have come out of this meeting. Thank you very much.
I think it's been a terrific hearing. I look forward to the next hearing on the insurance issue with Department of Managed Health Care and the representatives of the industry, and then we will continue to move forward. Thank you. Thank you all.
Okay, this will be a time for additional public testimony. And
just had a quick comment on the mic, I guess.
yeah, would you come up to the mic and then identify yourself for the record, please?
I'm Jose Fuentes. I'm in the Inland Empire area. One of the questions that was brought up was the issue of insurance and coverage of the different types of services and so forth. And one of the problems with ABA services, and there's a current bill out or for proposal 1282, which actually I think we need to modify language or address language, because there's a significant difference within the world of insurance as to providers that are licensed versus non-licensed or non-clinical services. And currently, in the way that applied behavioral analysis is certified, I think there are a lot of concerns as to what floodgates, if you will, that would open from an insurance point of view or a medical side of treatment. And I think that's something we may need to look at as the verbiage on that particular part of the bill.
Okay. Thank you for bringing that to our attention. Thank you. Is there anybody else that would like to please come and join us at the table here? Make sure you give us your name and
thank you, Senator.
Your affiliation.
Jim Lantry. I represent a number of autism treatment providers as well as parents of autistic children. One of the things that was mentioned this morning or this afternoon is we talked about ABA and the importance of how this state-of-the-art treatment should be covered by medical insurance. I'd point out that that's true. However, that is not the only state-of-the-art treatment out there. One of the things autism treatment providers like to say is that if you've seen one child with autism, you've seen one child with autism. It is a wide spectrum, and people react differently to different kinds of treatment. So I would encourage the committee, as we move legislation forward, to maintain that other state-of-the-art treatments are also equally treated in the legislation, because it's important for children and their parents to have those choices to make sure that what is done correctly. Okay. Thank you.
Thank you. By the way, we have 3 or 4 chairs here, so please make yourself at home.
Randy Hicks with Californians for Disability Rights. Now, we'll touch on a couple of these things. One was about education. We're all for education, for disabled folks being educated, and for autism spectrum. The thing of it is, we have to make sure that the equipment they use is accessible. Accessible screen readers. There's been studies done about accessible screen readers not being able to be used. And then that's about education for housing. I think you better have a department discussion with Department of State Architects on this one, because architects and the State Department have resisted putting in accessible housing, or they don't believe that affordable and accessible go together. So that's the other thing. And the other thing is, most people who have DDS have to use large chairs, and the thing of it is, they can't use the bathroom. I can't tell you how many times we've had stories from CDR of folks who needed to use the bathroom and couldn't use the bathroom because the bathroom's too small. So we really need to widen the bathrooms. And As for employment, the other thing is about the one-stop career centers. Even if they do get them a job, they can't get into the center because it's not accessible or there's not accessible materials. So it's really all about the ADA. It's to making sure that all the folks have equal access to everything. Thank you.
Okay. Thank you. Yes, ma'am.
Hi, my name is Rosario Alberro, and I work at UC Berkeley at the School of Public Health. And my comment will be to the Early Identification and Treatment Task Force. It was briefly mentioned that the outreach component is essential to this group. So we have to outreach our community in a very fast and effective way. Therefore, culturally competent outreaching is very, very important. Linguistic outreach competency is very, very important. And at the Health Initiative of the Americas at UC Berkeley School of Public Health, I think we are good on that. So we would like you, this task force in particular, to consider the Health Initiative of the Americas at UC Berkeley as a resource in order to outreach to one part of our community, which is the Latino constituencies, because we have a huge network of community-based organizations who can do to transmit the word, especially when we have to talk about early identification symptoms.
Okay. Thank you.
Hi, my name is Anu Mohan. I'm from Kern Regional Center. And I know that we had initially submitted a survey that we were recommending that parents should take. I know there's been some talk about website. I think it would be a great opportunity to put the survey up at the website so parents can go and kind of assess what kind of experiences that they're having with the insurance company. I know there was a huge talk about challenges that the parents face day to day and the services being denied because of educational versus medical necessity. I think it's a very important, something we need to hear from the parents, what experiences that they're having. And I know that in Kern County, Kaiser is also sending their reps out to find out what services are available in the community that they can provide for the people with autism. So I know that they're being also pressured by the family to do that. So I heard from Grapevine that is happening, and that kind of shows some efforts that are being made by the insurance company as well. So I just want to submit my first survey that we kind of came up with, and we're definitely working on it as well.
If you'll give it to the sergeant back there, he's right behind you. There you go. Thank you.
Just want to say this is the initial one. We are going to work on it better.
Well, we'll make sure members of the task force they get copies of it.
Thank you very much.
Thank you.
Hello, I'm Mary Mulway. I'm the co-chair of the South Counties Task Force, and I'm also the director of client services of New Vision Autism Center. We're a nonprofit autism center in Temecula, Southern California. And earlier we were talking about early identification and screenings, and one of the questions that was brought up is how can we pay for those? So we're a nonprofit organization. We're using a grant from Kaiser Permanente to do free screenings, and we've just started outreach screenings yesterday. We did one in Moreno Valley with a team, much like Dr. Ismara was talking about. So we'll be adding a speech pathologist and others onto that. We're going out into communities where there may not be transportation or linguistic access, taking translators with us so that we can do outreach screenings, and that's being paid for with a foundation grant. So there are other funding sources available to do that, and if it's successful, they have indicated that they will re-up our grant for next year. So that's one option for early identification. Secondly, I think it was Dr. Blatcher indicated that that the autism diagnosis rate is disproportionate depending on the cultural background of the family. And so what we find in some cultures is that students aren't being identified until kindergarten, but they've already missed the opportunity for early identification or intensive intervention because it's 0 to 5. So one of the recommendations that came up this morning is that that rule be changed so that it's 5 years of intensive intervention after the diagnosis. So that if these kids are being identified at the age of 5, they still get 5 years of intensive intervention before the services are cut off. And that will still reduce their lifetime costs by 2/3 if you get in early. So that was another thing. And then my last comment, in my former life, I was an assistant principal at a high school, and I oversaw career technical education at my school. So when Senator Steinberg was talking about CTE and how important that is, one issue related to that is, unfortunately, a lot of kids with disabilities are not allowed into those programs because they're viewed as a liability. Whether it's for cognitive delay or gross motor difficulties, that they consider them to be a liability to be around the machinery. And those are run by county offices of education. And those teachers have a different credential, and they're not provided training to deal with children of disabilities. So there's a few issues involved in there that would have to be addressed for that to fly. I think it's a fabulous idea, but within the bureaucracy, there's some things that would need to be altered.
Yeah, my wife's a community college professor. She teaches X-ray technology under career technical education. You're right. We've ran into. I know she's ran into some challenges as a result of that, because there are some physical and mental requirements that somehow we're going to have to. There's not everything is going to fit, and somehow we got to figure out how to accommodate some of that. So it's. I think it's a good point you brought up.
Thank you.
Thank you. Yes, ma'am.
My name is Karen Fessel. I do health insurance advocacy for families with autism, and one of the things that I'm seeing is that there's sources of income for fining. If we could get a better handle, have the regulator get a better handle on enforcement and send more of these violations where the insurance companies are not upholding the law like they should be and following AB 88. If we could have them send more cases to enforcement, and then they would deliver fines against the insurance companies, and that money, I feel, should go back into the autism community, and have the either offer grants up to autism agencies or somehow get that back to the community, because it's money that could be tapped and it's not.
Okay, I think we can look at that. Yes, ma'am.
Hi, Kristen Jacobson from the Bay Area Task Force. I wanted to make a comment on early identification because I was participating in a different panel. The Autism Community Parent Group Alliance of California Autism Organizations discussed the trailer bill cuts from last year, and there was one cut to eligibility for early start that had a really dramatic impact on the autism community by changing the eligibility standards for people 2 and up, that you had to have a higher delay to get early start. And it was theoretically trying to cut out people that didn't need it, but it's actually most kids with a language delay with autism are referred at 2 with the language delay, but by then if they have one word even, they would no longer qualify for early start. And as Senator Steinberg so eloquently put, what we need is to focus on the early intervention, and if they're excluded from early start, then they don't get that early intervention, and then they end up as consumers for years and years and cost millions of dollars. So that only saved $15 million. The autism community would be more than happy to find $15 million somewhere else to reverse that back and go back to the old eligibility requirements for early start, so that those children would have the possibility of getting early intervention and then not needing to have full lifetime support.
No, and I think you're right. I was a long-time community advocate about stepping up and helping with various types of programs and causes, and until we figure out a way to get this economic engine of California restarted again to where we can provide more. I think there are some groups, opportunities like what you just expressed, to where we can set those mechanisms or do what we have to do to put those in place, so that there are organizations and companies and individuals out there that would help to augment that program, and I agree with you.
Because right now you're having clinicians like Stanford. I've talked to their development clinic, and they will no longer even refer kids over to the regional center that they know won't qualify because they can't. The prevention program doesn't have services, and then those kids don't get referred to the school districts at 3. Then they're not anywhere till 5, and you just cut out 3 years of intervention for children who have autism and really need that.
Yeah, excellent point. Yes, sir.
I guess I'm closing up the act. Dave Michaels, CART, Kern County. This is from a parent. I have 2 autistic sons. And the comment I have to make is coming into this and coming out of it, as a parent, you can't feel the heart. And as I'm going through the room and I'm seeing what we're doing for autistic kids, as a parent, makes you know that the future for these children and the future for all of us is extremely bright.
Thank you.
Thank you.
wonderful way to end the meeting.
Well, it does seem to be an appropriate close for our meeting here. Unless there is somebody who'd like to add something, we'll go ahead and adjourn this meeting, and I look forward to continuing to work with all of you to try to come up with some productive ways of dealing with these kinds of challenges. So thank you again for your attendance.